As many of you know, about 10 years ago, HIA-LI embarked upon a feasibility study to take a look at the impact of the industrial land now innovation park today and the impact it had on the Long Island region. And those numbers are legendary. But, you know, to have 1,300 plus businesses and 55,000 employees in one 11 square mile thing, is a lot of economic opportunity, but it has a lot of challenges as well. So we got a playbook, right? We have a feasibility study, and it sort of gave us 10 points that we needed to focus on to help cultivate and develop stronger economic development here on Long Island. And that's been the precipice for you know, for our meetings, for our gatherings, for our programming, is trying to really highlight and spotlight and advocate for those points. Obviously, one that we've been very big on is housing, right? Housing is a tremendous issue here on Long Island. We do a lot of programming with regard to housing, and that was one of the highest points that was highlighted on this feasibility study. Another was infrastructure. We do a lot of advocating for sewers infrastructure so that building can occur here on Long Island. One has been travel and transportation, and we've been strong advocates right here for the airport and other hubs to be able to do it. And one of the biggest pieces that we're starting to embark on now is healthcare, right? So we have here on Long Island, healthcare is our #1 employer. So of all the employees here on Long Island, healthcare by far is the #1 employer. And I think nationally, when you see the jobs market and growth come out, it's always healthcare that's always leading the charge, which is great. You know, leads to, like I said, a lot of challenges. It leads to housing. We're living longer. Healthcare is more efficient now. We're living longer. So we need more senior facilities. We need more senior care. We need more of things, you know, along those lines. It's also on Long Island. The largest part of Long Island's GDP comes out of healthcare, right? Which is good and not so good. Because keeping people living here on Long Island with such a high tax burden is incredibly, incredibly difficult. And compare that tax burden, the housing costs, and then expensive health care, we have a lot of challenges into keeping our folks here on Long Island. But we want to keep them healthy, and we want to keep them safe. And so today's conversation, you know, we have 3 incredibly great panelists. This is really an A-list panel for us, and we're happy that they're all here. But we're going to be talking about, you know, sort of globally and macro, where is healthcare and how come it is kind of so expensive right now, and what's going on with that, right? And then how are we utilizing tech and AI and innovation really to drive efficiencies in terms of provider care, right, R&D, and cost, right? So I think by the end of this, everybody's going to have just an incredibly deeper understanding of healthcare systems, healthcare insurance, service providers, and cybersecurity and AI that's being implemented in the healthcare space. So what I want to do is just have the panel introduce themselves and sort of give a couple of minutes, right, of who you are and what you do and sort of how you got there and what you're working on. So, you know, we want to start with Dr. Testa from NYU Langone. If you could do that, that'd be great. Thank you.
Thank you so much, and I appreciate everybody having me here today. Paul Testa. I grew up in New York City, but I came out here a lot. I grew up coming out to the South Fork. I'm an ER doc by training and practice. And I kind of wandered a little bit, and I realized early on, as we started implementing technologies, I did my training at NYU in Bellevue. I've been there 22 years. And it quickly became real obvious to me that if you tinker with technology a little bit, what happened over the last 20 years in healthcare is we've redefined the experience of how clinicians interact with patients, how patients interact with their own health, and how we put everybody together in a single system. My chairman of emergency medicine sent me to an order set validation meeting because he said he never wanted to know what that was. And I got hooked about 15 years ago in technology and informatics. So I get to live between the world of the practice of medicine and how we leverage data and technology to impact efficient care, the highest quality and safety in the country. That's my job, to bring all those 3 things together to affect the experience patients have in our system. And as we continue to expand, we do that in an integrated fashion. One patient, one record, one chart. So wherever you go in an NYU system, whatever you see, whatever app you launch, all your data, all your information, all your ability to transact with us in your care should be in that app. Thank you.
Yep. Kevin, back by popular demand, we have Kevin Deutsch from Softheon.
Thank you so much, Joe and HIA, for having me back here. Kevin Deutsch, I'm the Chief Growth Officer at Softheon, headquartered here in Stony Brook. My story is interesting. I've been in healthcare my entire career. I graduated college on a Wednesday. I started working at Softheon the following Monday, and 12 years later, I've been seeing all of the challenges that we've experienced in healthcare. And Softheon's mission is to make healthcare affordable, accessible, and plentiful. And the way that we're doing that is we're working with mainly health insurance companies and supporting their operation to do things more efficiently than they are today. And I think we're going to get into the conversation quite a bit, but inefficiency is a word that I would use to describe some of the challenges that we have in healthcare.
Great, thanks. And Russ Epperstein.
Again, thanks everyone for coming here today. Again, Russ Epperstein. I'm the president and CEO of Next AI Cyber, but I always tell everyone I'm a recovering CPA. So I did my penance at KPMG early in my career. I was the head of audit for MetLife back in the day. But about 17 years ago, I got a little bit of a bug. I always tell everyone I wanted to be the baseball dad, so I start my own business, right? But I got a bug in IT, and it's really focused on a couple of key things. So did a lot of work helping large companies do healthcare analytics for self-funded health plans, so did a lot of work in that space. Secondly, second company I started in AI, which by the way, I have 6 patents in AI, so here I am. You can maybe say I got bored easy and I moved around a little bit, but 6 patents in AI. One of the companies that's still going on this today is focused on genomic research, drug repurposing, and things in that space, doing a project with NASA, so pretty cool work there. But for the last 7 years, I've led 2 cybersecurity companies. One that did a lot of work in incident response, worked with 35 insurance carriers, working and helping companies through, I'll say, very bad days that they were having. And now, currently today, Next AI Cyber really kind of focused on a couple core things, but I would say, really look at it, it's really a culmination of my entire career, which is helping companies through, I'll say, 3 core things. 1, cyber resilience, helping companies before, after a bad day. 2, helping companies with GRC, so governance, risk, and compliance. And 3, AI governance, helping companies implement AI properly and well-governed. So as we talk about a number of things relating to what we're doing, you know, to me, what's interesting is I talk to clients today, even if it wasn't an AI conversation, it goes about AI. You just asked about, do we use ChatGPT or Claude or anything else where everyone uses? The reality of it is that we're all getting the pressure to start being more efficient and effective, and tools can help us. But, you know, I'll say this, I like to be augmented intelligence, which is kind of the term that's been thrown around a lot lately, and that's helping humans be more efficient and effective using some of the tools that are out there. And I think that's a critical development that we're all kind of dealing with right now, is how do we become more efficient and effective at our roles, but use the information we have to do that. So
that's great. So, Doctor, I'll start. I want to ask you a question about NYU Langone specifically. I mean, you guys have grown so much, right? And you've grown with an impeccable record and an impeccable reputation out there. And I'm wondering if you could explain sort of that growth and how you've implemented, you know, tech for efficiencies and AI specifically now to help you with that growth.
Sure. Thank you. It's a nice question. I appreciate it. The last 18 or so years, Dr. Grossman, our Dean and CEO, set out a plan for us, and which was not to grow in the inpatient setting, but to acknowledge that care is provided in the ambulatory setting, in the offices that are around us and at home. So that footprint grew tremendously. A lot of the health system committed to hospitals, which are expensive, large, important places you go for very specific things, for very specific parts of your care. So as we expanded our ambulatory, we have, depending how you count, between 350 and 400 ambulatory locations in the region and Florida. Another vision of his was be incredibly rigorous with how we collect store, and make use of the data. The data drives what we do. That's efficient, that's good stewards of resources. We are a large nonprofit. Our margins are razor thin in many ways, so that's important. With ambulatory came the expansion of hospitals in that we acquired and merged together with health systems in Long Island in particular, starting in Brooklyn and moving outwards. That has been possible because of technology. I think that's not just, that's the ED doc in me talking as much as the technologist. The number one rating in safety and quality is incredibly important to us. And we expand quality by expanding our technologies. The way I will treat congestive heart failure in one ER is the same as we would treat it in every ER. Because the pathways, the evidence-based medicine, the meds we order, the follow-ups that happen when you transition to your ambulatory setting, to your primary care doc, to your PCP, all of that is connected. So as we came together with Long Island Community Hospital, and the moment we went live with our 150 systems on that first day, all of our quality dashboards lit up. And we knew what was different. We knew what had to change almost immediately by the data. Yes, we had lots of ideas and things were done, but when we're all looking at the same data, we're no longer fighting about the source of quality. We're all functioning from the same data set, from the same dashboard. And that's sort of been our strategy. And I would just wrap it on that. One other thing is the experience. We are almost all digitally native now. And I have an 85-year-old mother who is in the NYU Langone Help app all the time. It's not just because I helped work on it. It might have a little bit to do with it.
She's just showing it to her friends. Look what my son did.
It's wonderful. But once you activate an older patient, they are much more connected to us than the young ones. So I'm not going to suggest that because it's an older patient they won't use technology. It's not. From the 13-year-olds to the 85-year-old mom, it works. And it brings them together with their technology, which is the same. That's our strategy for our quality.
That's great. Thank you. Kevin, same type of question, right? So Softheon has seen rise of the ACA, rise of Medicare exchange, all and everything now is completely changed. So and for disclosure, I've worked with Softheon for 20 years, right? So I've seen it from a different perspective, but from the inside, right? And now as the Chief Growth Officer, what have you seen healthcare from your perspective changing, and how do you see it changing now, sort of going forward?
Well, I started by saying that I've been in this for the past 12 years, and I was, just last week, I was at a major healthcare conference with health plans mainly, and the keynote speaker, the main topic, and sorry if you laugh, prior authorizations and fax machines. I mean, if that doesn't say enough about where the challenges are in healthcare, I think I could probably end my statement there. But there is so much inefficiency, and everybody has to make money in this. That's another problem. So there's regulatory pressures that are coming down from the government, depending on which administration is in office, which is causing pressures on each of the different constituents of healthcare. And the only way that the costs are going to ultimately get curbed is somebody has to take a pay cut, whether it's the doctors, whether it's the hospitals, whether it's the health insurance companies. So we have quite a challenged system that has continued to grow and grow and grow without taking an opportunity to take an inventory and say, where are we and how do we do things more efficiently, like Dr. Testa was saying. So there's a tremendous amount of opportunity, and we've been at Softheon trying to force some of that in the health plan space specifically, but there is just a ton of inefficiency. And I think the data is really the pinnacle of all of this. If the data is not enabled, then you're causing a poor experience for consumers, you're causing these inefficiencies, which is causing additional costs to be put into the system. It's a major challenge. And one other thing I want to comment on related to consumers, everything that we do in our lives, we have control over where we're spending our dollars. In healthcare, that's still not the case. They talk about all of these price transparency rules. I don't know about you, but if I go and get a procedure somewhere using my health insurance specifically, I have no idea what it costs. It may be significantly cheaper down the road, but I don't know. I'm not an informed consumer. And the only way that the consumer becomes informed is if you give them power and control over their data. So those are just a few thoughts of some of the challenges that we're currently seeing in healthcare.
Right, Russ, I'll get to you in a minute, but Dr. Testa, could you just comment on that, right? So the transparency, I think that's a real, there's a sense, be it real or perceived, right, that it's all a racket, right? They know what health insurance companies are going to pay, they overbill. Like, can you just talk about transparency and how that process sort of works from your experience? Because I think so you have an 85-year-old mother, I have an 85-year-old mother, and all she does to me is complain about the doctor bills that she gets, and she's getting ripped off, and all this other stuff. So that's a real dilemma. How do you guys go about it?
Transparency is exquisitely important. There is full stop. That's it. There's no need to qualify that. Price doesn't sit alone, because a price tag on a transaction, a price